Chapter 8, Creating a Caring Community of Learners. In this chapter, we will discuss the importance of building a community of learners in your classroom, as well as looking at how the teacher pyramid model can assist a teacher in making this happen. When building a caring community of learners, it's important to have a healthy relationship between children and their teachers. This includes engaging in warm and positive relationships, treating each other with respect, and learning from and with each other. When a teacher establishes a caring community of learners, they help children develop 3 long-term goals. 1. Develop social skills and self-regulation. This includes the development of a healthy self-concept and self-esteem, as well as developing a sense of efficacy. Number 2. Prevent social and behavioral difficulties by adopting a proactive approach to dealing with behaviors. And number 3, promote academic success by understanding that social emotional competence is linked to academic success. The teaching pyramid model was created by the Center on Social and Emotional Foundations for Learning and has 4 tier levels. Number 1, positive relationships with children. This is the bottom tier. Number 2, high-quality supportive environments. Number 3, social and emotional teaching strategies. And 4, intensive individual intervention. This is the top tier. Each tier has specific interventions and supports. Think of a child you currently work with or know. Which of the 4 tiers could this student benefit from and why? The attachment theory states that children's ability to learn depends on their developing trusting relationships with caregivers. There are 4 types of attachment: secure, insecure avoidant, insecure obliviant or resistant, and disorganized or disoriented attachment. Secure attachments are responsive and sensitive relationships with caregivers that allow children to venture forth and comfortably explore and learn about the world. Insecure avoidant attachments are those in which rejection and insensitivity from adult caregivers causes children to turn away from or avoid adults and not seek their comfort. Think of one of the following examples of each type of attachment. Also, what is the difference between insecure, ambivalent, resistant, and disorganized, disoriented attachment? Be prepared to share in class. When establishing a learning community in an infant-toddler setting, it's important to do 2 things. 1. Listen and respond to verbal and nonverbal cues. And 2. Model empathy, warmth, and caring. When establishing a learning community in a preschool or school-age setting, it's important to do 3 things. 1. Organize cooperative learning experiences. 2. Model respectful behavior. And 3. Model and teach conflict resolution. Teachers must understand that there are differences in views of children's behavior, and that they can be personal, family, or cultural in nature. These differences can determine what is deemed acceptable behavior and/or safe behavior. Can you think of any examples of these 3? Teachers must examine their own attitudes towards challenging behaviors. This involves being able to identify the differences between mistakes and behaviors and misbehaviors. Mistaken behavior is an alternative term for children's misbehavior, recognizing the fact that young children are still learning acceptable behavior and that they are bound to make mistakes. Also, teachers must understand that all behavior is functional and is one way a child communicates. Teachers must observe and evaluate that behavior to determine what the child is trying to convey. When organizing high-quality supportive environments, teachers should look at 3 key areas. 1. Physical space, including the development of learning centers. 2. The schedule, including the transitions and routines that will occur during the day. And 3. Setting up clear, consistent rules for behavior and learning expectations. There are several ways you can support children to do their best, including 1. ignore undesired behaviors when appropriate. 2. Redirecting the behavior. 3. Providing the child with positive feedback. 4. Providing the child with encouragement. In addition, teachers should understand the difference between guidance and punishment. Guidance teachers use appropriate behavior through fostering emotional literacy, teaching social skills, and teaching conflict resolution. Punishment does not teach. An example of this would be the use of timeout. There are times when a teacher will have to implement an individualized intervention to help improve the child's behavior. Individualized interventions are systematically planned and implemented, including positive behavior support, or PBS, and understanding challenging behaviors. The ABC method is used to assess and address the function of behavior. The A in ABC requires a person to identify the antecedent of the behavior, or what came before the behavior occurred. The B in ABC requires a person to document the behavior. This includes describing exactly what was seen and heard when the behavior occurred. And C in the ABC requires a person to observe the consequences of the behavior. Do they extinguish the behavior, or does the behavior continue? The teaching pyramid model is often applied when teaching boys to build positive relationships, rethink the design of the environment, and to adapt teaching and intervention strategies to support positive behaviors in boys. It has also been applied to prevent and deal with biting and bullying in schools. Be sure to re-review the sections in the text on biting and bullying for strategies for preventing and dealing with both types of behavior.